you so much for listening to this episode of Earrings Off. We want to invite you to subscribe, rate, and leave us a review. You can find us on Facebook at Earrings Off Podcast and on Instagram at The Earrings Off Podcast.
Welcome to Earrings Off. I'm Lou.
And I'm Teresa. Let's get started.
Good morning. Today we're going to be talking about childbirth and Black women. So a fact, Black women in America have more than a 3 times higher risk of death related to pregnancy and childbirth than our white peers. This is regardless of factors like higher education and financial means. And for women over 30, the risk is as much as 5 times higher. In preparing for this interview, I found a statement on an NPR article, and it put it like this. This is one of the widest of all racial disparities in women's health. Put another way, a Black woman is 22% more likely to die from heart disease than a white woman, 71% more likely to perish from cervical cancer. But get this, 243% more likely to die from pregnancy or childbirth related causes. Today, Lou and I are speaking to Stephanie Spencer. Stephanie is the executive director of Urban Baby Beginnings. We're going to let Stephanie tell us a little bit about Urban Baby's Beginnings in just a second, but I want to just say this about it. It's devoted to breaking down, Urban Baby Beginnings is devoted to breaking down systemic barriers that prevent access to needed services while empowering birthing and postpartum families to take part and control their care. Welcome, Stephanie. Thank you so much for joining Lou and I with this important conversation. How are you today?
I'm just fine. Good morning, and thank you for having me. I'm really appreciative to have such a extremely important conversation regarding maternal and infant mortality and how we as Black women and Black families can protect ourselves and others from the negative effects of racism, which is a root cause of maternal mortality in the United States.
Okay.
Yeah. So would you tell us a little bit about the work you do with Urban Baby Beginnings?
Sure. So our organization has been around for 26 years. We started as a local childcare working with families in the community who did not have access to safe haven for their children to go. Mm-hmm. Many of the families were homeless and in destitute situations, and we felt very strongly about the fact that children needed to have support throughout the day, and their families needed to as well. And so over the years, we've morphed into different things because the community has asked us to. They've built Urban Babies. Wow. And what we see now is a maternal health system where individuals can present regardless of income and get support by either a licensed nurse or a paraprofessional such as a doula in the community. We also take opportunity to train people on how to be community doulas because we feel like this is a rite of passage and it helps to change generational outcomes when we're exposed to information. So our true goal overall, obviously, is to reduce infant and maternal mortality, and more specifically for women of color and for Black women. That's imperative because the health of our nation is dependent upon the health of our children. And so when we're working in this system, we are nurses and professionals, paraprofessionals such as doulas and lactation consultants who are committing to ensuring that our families have access to high quality services that are culturally appropriate and needed for the individual who may be pregnant or postpartum.
Okay. Thank you, Stephanie. But before we go into some other questions, I want to make sure that we're providing the foundation for our listeners. So can you please explain what a doula is and the lactation specialist?
Absolutely.
Just so people who maybe aren't familiar with those terms might know what we're talking about.
And that's a good point to place out there, because many people don't know what a doula is. And a doula is a non-licensed professional who provides emotional and physical support before, during, and after birth. I'd like to make a distinction between a doula and a community doula, because there's all different types of doulas. There's doulas who specialize in the prenatal period. Some specialize in postpartum. Some do everything.
Wow.
But what we know about community doulas is that they are birth workers who serve the community from which they are from. And they are reflective of that community. And they support the birthing person during the perinatal period up to 1 year's time span. And to throw in there, when we talk about lactation support, like breastfeeding support, that's a counselor that can go into the home or be someone who breastfed their child.
Right.
And they can help another person have a successful experience in their breastfeeding, with the sole goal of ensuring that a mom is supported, or an individual or birther is supported, but that we can expand or extend breastfeeding as long as possible, so that our babies have the healthiest chance at life for the long term.
Right. Okay. Thanks.
I have a question about that. Those two, lactation support and doulas, are they covered by insurance typically? How are they funded?
Right. And that is a huge challenge. And that's one of the big questions. So doulas traditionally are not funded by any private insurance at all. Most of the time, individuals have to pay out of pocket, or the doula has to offer their services at a reduced cost, especially if they're wanting to serve their community and their community happens to be in marginalized population. Lactation consultants, it's dependent on many factors. Our International Board of Lactation Consultants, who are certified, who have received education and training up and above and beyond the peer-based specialists, if they work in clinical settings or have a reporting structure where they report to physicians or work in other institutions, they can receive some level of reimbursement, but that's varying based on the insurance company. But most lactation consultants aren't reimbursed for their services as well. And I don't know if it's an appropriate time to talk about it now, but I can say that in the state of Virginia, what we're very proud about is that we have been advocating, along with many advocates across the state, for doula coverage. So Virginia, as long as the General Assembly passes the new budget, there's $2.3 million, I believe, in funding for doula support for certified doulas. Yes.
Oh, that's great.
We've really been working to try and ensure that there is coverage for doulas, especially for the Medicaid population, and this is what funding will cover.
Oh, that's excellent. Yeah,
absolutely.
That is excellent.
Okay. Yeah.
So Stephanie, would you tell us about the role that race plays in healthcare provided to Black women that are pregnant?
So what we know is that disparities do exist in infant and maternal mortality, and they are rooted in racism. And you talked about that several years ago when we were talking about the statistics. What we knew was that 60% of all deaths were preventable for Black women, yet they were continuing to occur. And what happens is that structural racism creates these inequities. And so we see that through the delivery of social service programs and also healthcare. And so what that means is, for an African-American woman, that they're more apt to receive poorer care than their white counterparts. And Black women are more likely to be denied care when they're in pain. They're less likely to be believed when they're presenting for care and having a challenge. And they're often the recipients of disrespectful care and care that is not dignified. And so what happens is, over the time, this experience causes weathering. And weathering is a concept where it's an accumulation of stressful events over time.
Right.
And when that person is in a vulnerable period, such as pregnancy, those effects of stress take they take a long-term toll on their physical and mental health, and you start to see it present in the outcomes for their pregnancy, along with just health in general. Mm-hmm. And so what this does is it places the Black woman at a higher chance of poor health outcomes, and also outcomes for their babies. And when we talk about race in healthcare, we can also say there's a huge underinvestment in service programs. And when we talk about that, when I say service programs, what I mean is Medicaid programs, food programs, their reproductive health programs. They're constantly evaluated for budget cuts, and they're harmful for families of color who often are overrepresented in these types of programs because of structural barriers. And those structural barriers are based on economic opportunity. So this all goes back to the same thing of what I was talking about, which is structural racism. And lastly, what I want to add to that is that when operating as a Black person in a toxic environment places the person at risk for poor outcomes, including death. Because when you have to advocate for respective high quality care, it's a sign that your life is endangered. You shouldn't have to advocate for respectful, high quality care. That should be given. And what it means is that when you're having to advocate for high quality care, everything that's around you then places you in danger, because there's people around you, there's environments around you that are responding in ways that place you in a environment where you're now fighting for your life. And so race does play a huge part in healthcare, no matter whether or not people want to admit it or not.
And that's an excellent point. And Stephanie, before the woman gets pregnant, their health, we're many times already at a disadvantage, just like what we've seen in our community with the coronavirus. So what role because while we certainly know there is systemic racism and all of the barriers, but what role does the health of Black women play?
It plays
this topic.
Yeah, it plays a huge role in outcomes. You talked about, Black women are 2 to 3 or 3 to 4, depending upon where you are in the United States, times more likely to die. And we talk about pregnancy-related conditions, but we also talk about conditions such as cervical cancers or just cancers in general, which can kill women in their earlier parts of their lives. And it causes a systemic effect, which in the end can cause things such as cardiac related issues and hemorrhage, not having hypertension evaluated or treated. These are things that place Black women at a disadvantage when they enter into pregnancy. And the problem with that is that when you have pre-existing conditions are not addressed prior to pregnancy. You enter into pregnancy and someone's trying to address those things, and some things they can't. But the other part we know about when we're talking about health, we tend to talk about like the physical health, but we fail to also talk about the mental health of a person, how well they need to be able to enter into a space which should be a very joyous moment, which sometimes can be really trying on the body. And, what we know for Black women is that regardless of income, education, geographical area, that their outcomes are the same, right? And we know that these are generally factors that are protective factors against poor outcomes in pregnancy. And so, what we know is research tells us that weathering causes the Black body to break down because of increased pressure and extenuating variables that we face every day. So we know that there's a direct connection between racism and poor health and poor outcomes for women of color, and more specifically Black women.
So Stephanie, even if you take out the educational level, the socioeconomic status, there is a bias in the healthcare system that causes, if you will, these poor outcomes. Wow.
Absolutely.
Yeah.
And that's a
Yeah.
strong statement to make. And
Yeah.
it's one of the things that I think that people fight against, because we've been so taught that, if you educate yourself,
Right.
you
Yeah.
do all the,
Yeah.
you should have the best outcomes as possible. And I'm not saying that education doesn't have a factor to play in many things, but you can't explain away
That's
these
right.
circumstances
That's
where we
right.
have Black
Right.
women who are educated, who are
Right.
entering into these systems and losing their lives, losing
Right.
their babies, or
Right.
having poor outcomes
Right.
because of the treatment that they received in the settings that they entered into. And it may not even just be the birth. It could have been for the entire 9 months
Right.
that
Right.
they were pregnant, or even in the postpartum period up to the first year or two, that we're still seeing the effects of poor treatment in the pregnancy and postpartum period.
Mm-hmm.
Right.
Okay.
It seems like, listening to this and talking about it, it seems like alarm bells everywhere should be going off when you make a statement that 60% um 60% of women can die during this process, before and after. It seems like everybody everywhere, just like the coronavirus, trying to figure out a solution, should be trying to figure this out. And it goes back to the statement that Lou was just making and that you commented on. This is a big deal. This is mind-blowing that we have this happening to us and nobody seems to care about it. And it doesn't matter where we're from and what our backgrounds are, we can still suffer this tragic ending to what should be the happiest times of our lives.
Absolutely. I definitely agree.
I'll get off that soapbox. But yeah, so during when you think about if you're planning your pregnancy and all of this, and you have a pregnancy plan and excited about it, should Black women enter the conversation with their doctors any differently to affect outcome, do you think? What should those conversations be like as a Black woman with your doctor when you're planning to get pregnant, or when you find out that you are pregnant?
They absolutely must be different. And what I tend to see is that the patient or the client is the one that has to guide those conversations. And you brought up something important, that when someone is going to get pregnant, should they be talking about this? Yes.
Mm-hmm.
It's traditionally in healthcare, what we tend to do is we tend to look at things from an illness perspective. So when you present to me, I will listen to what your symptoms are, and I will give you a diagnosis. I will treat those things, and you'll go on. And then if you're having trouble, you'll come back. But I guide those conversations, right? But in what we talk about from a pregnancy perspective, and a practitioner is coaching, being able to, as an individual, set a goal for myself, which is that maybe I want to become pregnant in the next year. That is my goal. And I want to know how to have the best and healthiest outcome. And so I need to be in partnership with my provider so that we can talk about things, so we can evaluate, where am I today? What are some of the risks? What are some of the things that I need to do, to ensure that I have a healthy outcome? And, the way I say that Black women need to approach their care is as if their life depends on it, not just in pregnancy, but also, right? Because it does, right? And it has to start.
It does. It absolutely does.
Yeah, and it has to start at all levels of care. And what we know is that Black women are facing a number of barriers in their environment, and yet when they go to the doctor, the thought of providing care using a whole person approach is not used. So when we talk about the fact that, I'm a middle-aged Black woman, I have, 2 children, and I want to get pregnant, that's one thing. But also I have a whole thing, a whole community of people and an environment, a religious background. I have all of these things that surround me that I need to make sure that people understand about me, so that we can, when we talk about, these are some of the things that you need to do, maybe you also understand that culturally that is not something that I'm willing to do. And so we need to make sure that we're treating ourselves in a manner as if when we're walking through that door, that we are for sure advocating for ourselves, and we're including people in these conversations. And when we talk about conversations, we're talking about conversations about race. Have you cared for a Black woman before? What have been
That's very good. Yeah.
Yep. What does respectful care look like to you?
Mm-hmm.
And what are my expectations of you as a provider?
Mm-hmm.
And are you willing to provide me all of the information? Our conversation needs to be like that, because there's often a thought that as a practitioner, I'll provide you the necessary information that may be a 10th of the 100th % of what you need to understand. And that what that does is it guides people to make decisions without the full picture. Mm-hmm. And we need to make sure that we understand and have a provider that understands the importance of having healthy conversations around our care. And it needs to happen often and initially, and in every environment that the Black person enters into. And, I realize that there's an issue of access to quality care for Black women. And so I'm talking about something that I feel like a lot of times my moms say just is not available to them. They don't feel like they're in a space where someone's listening. But I've also operated in spaces with white women where I've been able to be referred to physicians and specialists and others who have provided the best possible care as possible. And it's a shame for me to say that the women of color that I've cared for have said that that connection is just not available. And just as an example, it's very apparent when I see someone late in their third trimester for the very first time who has a host of issues, who is looking confused and has not received any information. And the first conversation we're having is about respectful care, and it's coming from my team. And they've never been surrounded by that. And so it's common. This is common. And so I know for a fact that these conversations with providers just aren't happening. And, we have to advocate for ourselves as Black women when we're going into these systems, and we have to set ourselves up for the best possible success by opening those conversations early on.
Mm-hmm. Okay. Stephanie, so how important is it for women to attend the classes provided to them about what to expect during pregnancy, labor and delivery and post-delivery? How important is that educational piece?
It's extremely important. I mean, birth is very primal, and it can be very scary if you've never gone through it before, or if you did and it was very traumatic, or you felt that people weren't listening to you. I'm a certified childbirth and hypnobirthing instructor, and I've seen how the lack of knowledge about normal physiologic birth can play out in the birthing space. And
really?
Yeah, and what happens is that sometimes the lack of knowledge it allows people who are biased in the care that they provide to make suggestions to care that may speed up delivery, that may place the baby in danger, which may be looked at as an intervention, but for a client just seems like it's normal to do. And so what happens is that when you don't have that knowledge, it increases the use of interventions by practitioners. And that cascade of events can increase the chance of C-section or trauma or poor outcomes during the birth experience. And so what we know is when classes are taught in a safe space, what it does is it opens up a whole new world for that individual and that birthing person, who is the recipient generally of just bits and pieces of information during her pregnancy and experience. And we have to think about classes as this being the first time that the mother and her team of support is receiving evidence-based information regarding labor, birth, and postpartum and breastfeeding. And when it's taught properly and from a space of being culturally aware and in a safe space, it can be very empowering and extremely eye-opening. What I've seen in whether it be childbirth classes or whether I'm teaching a community doula to become a support person in their community, I hear women say that they didn't know what was being done to them was coming from a place of a lack of informed consent or information. And what happens is that now, once I've completed that childbirth education class, or I've completed that training, that the birthing person can more often recognize bias in care and racism in care, and more specifically when the classes are taught by Black women in the community. And from an educator standpoint, I can also say that there needs to be education on self-awareness of what's going on in the environment, and empowering clients for their birth, recognizing the role that, the support people play in this process, but also childbirth educators need to tailor classes for African American women. And we also need to ensure that people understand how racism influences pregnant people in their preparation for birthing, so that when we're teaching, we're not teaching from a space of that I expect for you to do this, and when you don't know what you're talking about. So we have to be very careful and mindful of that too, that lived experience drives the knowledge that people have, and they operate from that space first before they operate from a space of receiving information in a classroom setting about birth and postpartum.
And you know what, that's so important, because as you're talking about the education, and of course, as we feel like we have good, solid information, we feel more empowered, more confident, and that translates to how we then, how we're interacting with our new baby.
Exactly.
We're giving them cues.
Right.
We're anxious and nervous because so much is going on that we feel overwhelmed. That makes it difficult as you're trying to, walk in your role as a new mom with this child. So, yeah. So you see that impact all types of areas.
You do. You absolutely do.
Right. And that's actually, Lou, setting up the baby for, having to deal with being anxious,
right,
taking those cues from mom.
Right,
and it's kind of like a cycle.
Yeah.
And that's a whole other conversation,
right.
And that's unfortunate. That is so unfortunate that we have to deal with that.
Well, and like what you said earlier, Teresa, which should be the happiest time of our lives.
Yeah.
And
so we've spoken about it a couple of times about Black women just not being heard, right? And we've seen some real, high profile women deal with that in their pregnancy. One being very recent was Serena Williams, right? In her experience. What can we do to make sure that we're heard and we're given that appropriate treatment? I mean, how can we be sure, how can we get the point across that, yes, I am experiencing a pain that's very different than anything I've felt before, or this just doesn't seem right. How can we as Black women get that message over to our doctors? What should we do?
There are so many stories about Black women.
Oh, yeah.
And outcomes that are not acceptable. And, the simple fact that Serena Williams, who you would think has access to so many things, can sit there and say that I felt that I needed to guide people.
Right.
Tell them what they needed to do.
Well, and Stephanie, the other one that I read about was, I think the last name was Johnson, where her husband was there advocating for her. And no one was listening. Right? Yeah, I mean, so that to me that shows the bias when he was constantly trying to get someone to provide care for his wife. And she died.
And reading that story and talking about that story just hits home to a lot of people.
Yeah,
you start to see how racism plays out in a system of care for someone who passed away because there was a failure of the system to do a CT scan when it was ordered, and when he was telling them that something was wrong, and he wasn't listened to, and that is it is an extremely disturbing story, and it shows just how these types of issues can play out in an institution, in a hospital, and I think that when people hear stories like that, what they automatically think is they have no choice. They have no chance of having a good outcome, right? Because if Serena Williams, somebody who has money, needs to advocate for herself to the level of what she had to, and here I am, I barely have access, maybe on Medicaid, I've already had poor treatment, no one listened to me. They feel like they're going to enter into this space and have the same thing, and what I can tell you is that you can come out on the other side without these poor outcomes. And one thing I want to remind Black women is that they are important, they are loved and valued, and they must treat themselves like that when they're building their team of support. Pregnancy, health, these are not times that we need to sit back and allow for people to do to us, right? We need to be empowered, and we need to say we will no longer accept this level of treatment. And what's happening is, it's a couple of things. We're operating in a space where data is not available about patient outcomes in the public space. So when I go to a hospital, I may or may not know that they have a very high C-section rate. I may know about my doctor and the fact that he's been sanctioned. I may not even thought to really research those things too, because we're operating in a space of trusting the provider that we may have had for 15, 20 years. And it allows for systems to blame women, Black women more specifically, for poor outcomes. And it's the way it's cited is that their health or lack of knowledge caused the death, right? Caused the issue. And there's a lack of accountability in the institutional space. But what we know is when poor outcomes occur, what it shows when you research is that Black women presented multiple times for care, guidance, and support, and they were not treated or they were turned away. So what Black women must do is surround themselves with professionals and support people that can hear and believe in them, and family who can advocate for them when systems start to fail and there are care and communication breakdowns. We know this for a fact. There must also be an intergenerational approach to care. This means that families have to be a part of this experience by also arming themselves with the knowledge of childbirth, breastfeeding, postpartum recovery, postpartum issues, healing, and approaches to health from a wellness perspective. Because you can't point out bias and racism in healthcare when you don't know what should be happening. And the only way to know that is to be a part of the care of the mom and baby from the very beginning. Be there during those visits if you can. Listen in, ask questions. And lastly, what I know about Black women is that you must find programs that support women of color. At Urban Baby Beginnings, we have a network of support specialists that span from the community into hospital-based systems. And I can pick up that phone and I can call and I can ask for help when we're in a system where maybe we're seeing bias in care or we're about to see a poor outcome, because we have worked so hard to develop collaborative care models that support our Black women when they enter into these systems. And our program is led and supported by women of color. So we have a unique view of care because we've been through this system and we know what all of our members face. And I really want to ensure that Black women understand that they should not wait to connect to spaces like Urban Baby Beginnings or others. And I think too, I want to see Black women, what I know Black women need to do is they need to remember their lifeline, because what happens is things start to spiral out of control. And then it's at the point where we can't bring it back. And no one knew what was going on. And that lifeline is that they need to pick up that phone. They need to phone their doula, a program, anyone, the advocate at the hospital, to get that connection that they need to ensure that they're connecting with someone they can trust and someone that has their back in that birth space. And they need to also include everyone in getting information that can help them, not only for current, but for future generations. This is truly a family affair when we talk about the protection of the Black woman and the Black person who is delivering a baby and bringing a baby into this world. It's extremely important. And this is not the time to just kind of sit and allow people to continue to talk over us as individuals. So we have to be very, very diligent, and we have to ensure that we're building our army. That's how I look at it. You're building an army of people supporting you, and a village of support has to exist for you to have positive outcomes.
Right. Wow.
This is great information.
It's great information because, sometimes there can even be a bias in our community, because some listeners may hear this and say, oh, really, it's not that serious. We've been having babies forever. It's what we do. And not realizing that the numbers show we can die, and we're dying at a higher rate. So this is an important issue that we need to be concerned about. But why then, Stephanie, hasn't more been made of this issue? Because it's definitely important, but for so long there wasn't any light being, this didn't really get the attention that it deserved.
Yeah, I think that, I mean, it's definitely an issue. I mean, it's been made an issue by Black families across the United States.
Yeah.
No one's listening. It's just like in care. No one is listening. And, I think about in the 26 years that we've been working with the community, we've learned just how dangerous it is to give birth in the United States, or even to raise a family while being Black. And
right.
We've been impacted firsthand by the devastation and loss and broken families due to illness and pregnancy and other related issues. I'm a direct recipient of that as well. I can remember the exact conversation, having this many, many, many years ago. And it's all stemming from bias and care and direct racism.
Oh, Teresa and I have stories as well, Stephanie.
And many Black women do. And the problem is that what happens is that when you're continuously talking about something and someone's not listening, eventually what happens, you shut down. And so you just kind of go through a system and the motions of a system in hopes that you come across on the other side okay. And then, for what we're seeing now is in the last 5 years, there's been a lot of publicity in regards to maternal mortality and morbidity. And then now, we were saying, hey, we need to have support from a community perspective to ensure that we have better outcomes. And then COVID hit. And now people are seeing just how devastating these disparities are.
That's
and
right.
There's also like almost an even playing field now, because now everybody's in a different environment than what they were, but still Black and Hispanic people have been hit the hardest.
Right.
And what we know is that with the conversation kind of transitioning in the last 5 years, now in Black infant and maternal mortality has been labeled a public health crisis versus a concern, right?
Mm-hmm.
And, because some of the things that have been cited is that there's been that lack of statistics that show just how bad the outcomes are for Black women. And we believe that a lot of the statistics that are provided are still hiding a lot of the outcomes that are related to pregnancy related deaths. And then you add providers who are in a system that structurally could continue to perpetuate systemic racism.
Right.
And you're seeing that there's a lack of information being provided, ignoring symptoms, and, just a disbelief. You get to where we are right now, where there's a huge issue that has been elevated and people are trying to figure out what's going on. But like you said, that's been going on for a long, long time. But, I have to ask, in this instance, like, when you know that there's so much more to do, yet there's an underinvestment in programs that can make change, and there's more interest in replicating the same very systems that perpetuate racist systems, and then in investing in the community programs that are doing the work, how can you see a difference in outcomes? So what we're trying to do is the same very thing that we've been doing forever. And so, what I'm really proud of in the state of Virginia is that we're starting to see the money and the efforts go towards Black maternal health. And there's also Black-led organizations across the United States that are starting to come together to say, we're going to take charge of our care. And we're part of an alliance of organizations that focus on improving health for maternal families. And organizations such as Black Mamas Matter, Jenny Joseph and Common Sense Childbirth, you've got Health Connect One. All of these large organizations have joined together to address this international crisis that's affecting our families. And what we know now, which is very different than before, is that Black organizations need to come together and communities need to come together to address these disparities, right? So it's not like in the state of Virginia, when Governor Ralph Northam came out, I think it was last July or so, and he talked about maternal mortality and wanting to eliminate that by 2025. It started a chain reaction of events in Virginia, which was expanding Medicaid. So we have over 400,000 people now who have access to health care.
That's been huge.
And expanding service programs and creating spaces for people to discuss these challenges and putting funding towards these efforts. I mean, the mayor's office in the city of Richmond and Dr. Avula came and, Richmond Maternal Child Health Task Force. I mean, we've got all the physicians that are talking about this, like the commissioner, Dr. Norman Oliver, and Dr. Carey, Health and Human Services. I can keep going. Mm-hmm. And, even there's been a perinatal collaborative called Virginia Neonatal Perinatal Collaborative that's also opened up space to allow for one thing, more than that, but one big thing, which is to allow for Black women to lead these efforts towards change. Wow. And that is something 5 years ago that would not have happened.
Yeah, that's huge. Okay. Mm-hmm.
That is huge.
So Stephanie, are we keeping? I'm so happy to hear that. Right, over the last 5 years, that changes is happening. Are we keeping any data? Do we have any results about all of this good work? Do we have any data to show how it's impacting the community, Black women in pregnancy?
So I think what's important to note is that these conversations over the past 5 years have led to where we are right now, is saying that funding needs to be given to organizations to help to propel these efforts. So when we look at data, that is not existing at the level that we need it to exist at this point, because really when we talk about trying to put these efforts together, we're at that start. We're not at the starting point, but we are at the starting point, right? Yeah, so that's important.
Well, I get it. Yeah.
Yeah, that's important to recognize. But what I think do know is that there's a huge conversation about how this needs to look and what we need to do for our communities. And part of that, yes, is tracking that data, but there's a whole lot more that needs to happen before we can even really get to that point of looking at that.
Is there something you want to share with listeners on this topic before we end? Any advice you can give to moms, particularly women of color, Black women?
I would say that there's hope, and there's a better world that we as Black women are trying to build. And it's a world where there's our future generations don't have to worry about entering into a space filled with racism, and more so where disparities between Black and white people are non-existent, and where mothers and children can survive and thrive. And it's important that Black women know that they are not alone, and that there are people that are out here that are fighting for them, with them, next to them, and that we're not going to give up at all. And we're going to continue to band together to make health and wellness a priority for women, and for Black women more specifically. And so know that there are people that are out there that are in your corner and rooting for you. And you simply need to reach out. We're all here. So I hope that this has been not only informative, but also that people can walk away from this feeling more armed about their pregnancy and knowing where to go to find the help that they need, because we're all out here for them.
Well, thank you so much for sharing your information. I can tell you, I feel more optimistic knowing that there are folks like you out there fighting and who care enough to stay engaged on this issue so that we see improvements, and that hopefully this is appropriately addressed and remedied.
Thanks for having me.